Let's keep it in the KUAM News Zoom room where we have standing by Alexa Perez Adkins, who's a pharmacist, and we wanted to bring her on. I don't know if you guys had saw that she had shared her COVID chronicles on Facebook. And we kind of wanted to bring you on, Alexa, and just talk about it a little more. So good morning, and thank you for joining us.
Good morning, Chris. Good morning, Sabrina. Good morning, Jason.
Good morning.
And if you could just tell us a little bit about your job and what you do, and then we'll kind of get right into it.
Okay, I'm a clinical pharmacist at GMH. I've been there since 2012. I am assigned to the intensive care unit. So prior to COVID, I was full-time in the intensive care unit, taking care of our ICU patients with the ICU team. During this COVID pandemic, my role has just broadened to taking care of non-COVID and COVID ICU patients, as well as just COVID patients in general in the hospital. I'm part of a team of clinical pharmacists that round on these patients daily with all of the intensivists and the hospitalists and the nurses. And I'm also a preceptor to pharmacy students. I'm part of the Code Blue team, so I attend those activations. Just all different kinds of things. I'm part of the COVID task force. I work on protocol and policy development with all the other different disciplines as well.
Right, and we see that. I mean, even just as recently as with Nurse Rose, who was just on, is she did one thing before the pandemic, and now she's doing 1,000 things. And so let's kind of talk about that, how it's kind of all hands on deck, and people are really stepping up and doing things, not necessarily outside of their comfort zone, but I mean, gosh, it sounds like you wear 10 different hats.
Yeah.
I think everybody is finding that they have abilities and talents that we just didn't know that we could do. There's a lot of very intelligent and very determined and very passionate people at GMH. So everyone is being brought together in this concerted effort of all different disciplines to pretty much it's all hands on deck. So whereas it may not be something you did on a daily basis before COVID, we're all pitching in however we can help.
And let's talk about the COVID. So you caught the virus, and you tested positive on August 31st. You've since recovered. But what can you tell us about your exposure and obviously what it was like to be COVID-19 positive?
So I was exposed while I was actually sharing a meal with someone who at the time didn't know that they were positive. It's so crazy because I work at the hospital, so I wear my PPE, I wash my hands. I'm so careful about that, or so I thought. But it was when I took off my mask and shared a meal with someone that I actually contracted this virus. And it was 10 days after that exposure that I actually tested positive. I had tested negative twice before that. So that just goes to show that this virus, people are testing positive later than the 5 to 7 days that we had originally thought. I tested on day 10. And prior to that, I had tested negative. So as soon as I found out that I was exposed to someone who eventually turned positive, I self-isolated from my family until I tested again. Once I found out I was positive, I went into strict home isolation for 10 days. So I was separated from my child and my family, just like the nurse who was on earlier. She described exactly what I went through. I was isolated in my room. I did not come out at all. All of my meals were delivered to my door, and any supplies that I needed had to be delivered to my door. I could not come out for 10 days. It was very scary, at least, initially. You see this in the hospital. I'm part of the team that treats these patients every single day. it's a different feeling when it happens to you. You just go through this immediate shock and then just guilt. And you start to think about everybody you could have possibly exposed, and you just have this guilt and worry until you know that they're okay. My husband and my child were pretty much the only people I allowed myself to be around. I haven't been around my family in over a month since the second wave started. So I was sick with worry until I found out, until they were tested and found out they were negative, and then the guilt and the fear and the anxiety calmed down a little bit. My symptoms were pretty mild. I had mostly congestion, severe body aches, and just tired. I was just tired a lot, so I slept a lot. I didn't really have fever, and that was the hard thing about this, is because I didn't have symptoms before I tested positive. I was asymptomatic. I went to work every day. We checked our temperature going into the hospital, and I had no fever. I had no symptoms. And that's why it didn't occur to me that I may have possibly been exposed until I found that out. Once I found out I was exposed, it was constant self-monitoring of symptoms and self-isolation. So, it's crazy like that. Not everyone has symptoms.
Right.
Not everyone's going to have the trigger to let you know that there may be something wrong and you may have to get swabbed.
Alexa, how old is your child?
I have two. I have a 12-year-old stepson, and I have a 2.5-year-old daughter.
How did you, I guess, explain, COVID and what your situation to your children?
So my son lives in Hawaii, and my 2.5-year-old daughter, I think it's good because she's so young that I think she's oblivious to time and where everything is, because she did not know where I was. She didn't know I was home. I was so quiet because I didn't want to make any noise in the room to make her start banging on the door, trying to open it. She's at the age where she reaches for the doorknob and she can open doors. So James did a really good job keeping her busy, and he was super dad for 10 days and took care of her.
Alexa, let me ask.
That was the hardest part.
Yeah.
We had Nurse Rose, and she talked about how to do a home isolation, and it sounds like you did it to the T. To you, is that the proof in the pudding that you can home isolate and still keep your family members safe from the virus?
Yes. I mean, it takes a lot of will and determination. It's very difficult. I found it very difficult to home isolate, just because I have a young child, and to hear her, cry and not be able to go to her and comfort her was the hardest thing for me. I think if you're able to, and you take on the huge responsibility of self-isolating and not coming out and relying on other people to help take care of you while you're in there. 10 days is a very long time to be in self-isolation and away from your immediate family. So I think it's a choice that everyone has to make. I knew I could do it. I didn't want to risk it. I didn't want to do anything to risk exposing my family to the virus. And even to this day, 7 days later, I still have that fear. I wore a mask around my family even 7 days after I got out of isolation. Just that anxiety that you just want to make sure that you did everything to not expose them. Even though I'm no longer contagious, I no longer have symptoms. I stopped having symptoms a while ago. So I think it's just everyone has to take on that responsibility. If you are positive, if you know that you cannot safely stay home and self-isolate, then you can find other means to do so. I was just lucky. I was fortunate that I had the opportunity to do it, and my family was wonderful. I never had to worry about meals. My extended family delivered meals to my home, so James could just focus on taking care of me and Camille.
Are you back to work?
I am. I returned back to GMH this Monday.
Oh,
Let me ask, when you got the virus and having been part of the team the Code Blue team, working with COVID patients in the ICU, seeing what the virus does firsthand, was there ever that moment where you didn't know which version of the coronavirus you were going to get?
That's the fear, the immediate fear that when you find out that you're positive, you're so scared because we've seen what this virus does to patients. It's a horrible virus, and I've seen patients at their most vulnerable and their sickest. Our patients are so sick, and I see them from being, having mild symptoms and just needing oxygen to being on a ventilator and needing to be sedated. And so when I found out I was positive, immediately the fear just sunk in, and you have to I had to calm myself down and say, you know what, I'm young, I don't have comorbidities, I'm strong, I can do this, I can fight this. And I immediately just thought of, my family. It wasn't even about me, it was about who I needed to protect. But yeah, that fear is real because of what we see every single day. It's terrifying.
We talked to Dr. Uggan, I think it was earlier this week.
Right.
And she just described what it's like working at GMH every day, how overworked and overwhelming it is there. And you going back, have you ever wanted to just, I don't know, I want to say quit. It just seems such a nightmare to have to go in every day and see what you're seeing. And I guess why do you stay? What keeps you motivated?
When this COVID pandemic first started in March, we had our first wave. I was there in March with our first patient. It's the scariest thing to face something that was so unknown at the time. There really any literature available out. All we knew about this virus was in Wuhan in Italy before it got to the United States. And then shortly after it came to Guam. So the scariest part for me was in March, at least because we didn't know a lot about it. And it was during that first wave when we had the positives and we had our sick patients, that you really sit there and you have to sit there and have to reflect about what it is you're doing and whether or not you can move forward with something that's so scary, because it's not only scary for you as a healthcare personnel and you possibly contracting this virus, but it's the fear of bringing it home to your family, which for me was way greater a fear than it was for myself. So, it's a personal decision that every healthcare personnel has to make. But for me, this is a calling. It's not a job. Mm-hmm. You don't go into this profession because it's just a job. You go into this profession because you want to help people. You want to help the sick people of Guam. And now more than ever, Guam needs healthcare professionals. They need people to answer that calling. So it wasn't even a question for me. And I have a very understanding family, an extremely understanding husband who is my number one fan and my greatest support system. So when I have these long days of staying with these patients, the sicker they are, the longer the days, the 10, 11-hour days that you're there, yes, it's tiring and it's overwhelming, but you keep going back because you have to. You can't leave these patients to fight it alone. They need the physicians, they need the nurses, they need the respiratory therapists, the pharmacists. Everyone at the hospital is so key into our battle against this virus. And they're some of the bravest people I've ever met. It takes a lot of courage and conviction to go into work every single day. And I think I'm just blessed and I'm honored.
But it's got to be difficult to say. How difficult is it knowing the risk every day that you take when you go in to say goodbye to your husband, to your child?
Uh, um, it's never easy. It's never easy. But he's my biggest support. So, you know, I do everything I can to make sure that I am protecting myself as much as possible when I'm at that hospital. I wear an N95 mask all day for 12 hours. Like, you know, you get the bruising on top of your nose and the seal around your face, and you're fully garbed up in PPE the entire time you're there, and you do all your decontamination before you get home. And I eat solo lunches. I don't even eat with anyone around me. This is what we have to do in order to make sure that you're doing everything possible. So I take comfort knowing that I'm doing everything I possibly can. I'm following all the guidelines in regards to minimizing the exposure. The risk is always there because I work in the COVID unit. I work with the COVID team, but this is part of our job. You know, we have to take care of these people. So you do everything you can to protect yourself, protect your coworkers, protect your patients, and protect your family. And, you know, it's never easy, but you just do what you have to do.
Mm-hmm. You're a hero to so many people. I have to say that. Who's your hero?
Yeah, I'm very humbled, and I never thought of myself as a hero. I think the heroes are just, you know, the nurses and the physicians and the RTs that I work alongside with every single day. They're my heroes. They're amazing, and thank you. I appreciate the support and all the love. I'm so overwhelmed by the love and support ever since I shared my story. It's overwhelming, and thank you so much.
Alexa, you're working today, right?
I'm off.
Oh, you're
I'm
off, right,
today.
right,
I go back
right.
tomorrow.
Right. So when you go in tomorrow, and we heard from Dr. Ruggan the very real scene that she described, you know, Crocs on the ground, PPEs decked up. When you go into that battleground, that COVID-19 war zone, and you come back out, what's the most important thing you think you can tell the people of Guam about COVID-19?
I think just knowing that we are all vulnerable to catching this virus. We are all at risk anytime you let your guard down. Mine is when I shared a meal with someone. So you don't even have to work with COVID patients directly. You don't have to be at the hospital. You don't have to, you know, it doesn't matter where you are. We are all at risk of getting this virus. So do everything you can to protect yourself and protect your loved ones and protect your family. And like I said in the video, I really believe that everyone is afflicted by this virus some way or another, and we just have to help each other out and take care of each other. Our frontliners are doing everything we can to take care of the sick, but we as a community here on Guam, we really have to look out for each other. And once we come out of this, we're gonna build this community back up together. We're in this together.
Thank you, Alexa, for sharing
Thank
your
you.
story.
Thanks for having me.
God bless you, and enjoy your day off, and wash your, well, I think I don't need to tell you to wash your hands. I just got out of class.
You wash your hands.
Yeah, I will. Thank you, Alexa.
Take care.
Thank you. Have a good day,
You
guys.
too. Appreciate
Thank
it.
you for having
There
me.
you go. All right. This is the link on the breeze, 93.9 to 741.
That was a rock star.
Yeah, that was awesome. Will the PCOR 1 lockdown be extended? We're going to try and find out next with Crystal Paco San Augustine, the Adelup press secretary, as the link continues right after this. Good morning.